So today we're going to have a look at professional reports and we're going to have a look at how we decipher them. You will be getting lots of reports in your journeys, and sometimes it's a bit of an overwhelm as to how many you get and what you need to look for. So that's the sort of thing we're going to cover today. Okay, so the first thing we're going to cover is why are professional reports needed. We're going to have a look at which reports are important and who will provide them. We are going to have a look at how to request the appropriate report and when to request those. We are going to have a look at what a report might look like, so what you'd expect to see in particular reports. And we're going to have a look at how to interpret some of those reports because they are slightly confusing at times. So, why are professional reports needed? So there are a variety of reasons for needing professional reports, and we're going to go into each one of these separately as we move through the slideshow. So the first reason is obviously to help you and to help the staff working with your child to better understand your child's needs. The second reason is obviously to support the educational health and care needs assessment process, which is probably why the majority of people are here today. And the third one is to provide information and details on provision that will then be used to populate the EHCP. So what we're going to do now is we're going to go into those in a little bit more detail. Okay, so which reports are important and who will provide them? So there are a number of reasons professional reports are requested. It's not always for an EHCNA or an EHCP, although by gaining the reports, it might lead down that path. So the importance of the professional report really does depend on the reason for needing them or for asking for them or for obtaining them. So it might be to help the setting with providing the appropriate support. It might be to provide evidence for requesting an education, health and care needs assessment. Instead of saying education, health and care needs assessment every single time, I'm just going to say ECNA so that you know what I'm talking about, because if I say that every time, I will trip up at some point. So to provide advice for an ECNA and to provide additional evidence for tribunals. And I have put a link in there, and I'll just check with Jess. Jess, people will get the slides, won't they? Yeah, so this link is going to be available. So this is from the send regs, and this details who should provide reports if these are going to form part of an EHCNA. But what we'll do is we'll have a look at the next slide, and we'll go into each one of these in a little bit more detail. So one of the reasons a setting might need a report from a professional is so that they can provide the appropriate support. So, and I think back very much to my days in school as a Senko, and I think about particular children and think about the work that we would put in to these children. We would try everything that we had available to us as a school. But we just would get to a point where we would think we don't really know what else to do. We've exhausted all of the usual support that we would put into place. So what we might then do is request professional support from somebody else. In the old days, and this is going to really show my age now, in the old days, it used to be called SEN. Oh, it was SEN, but it's now SEN support, but it used to be plus and something else. I can't even remember, it's that long ago. And what you used to do is when you were putting children onto the SEN register, you knew that if you were going to be sort of the higher level, that one of those reasons was that you'd obtained professional advice. So what that's telling you is that the school are needing further support. So I can give a couple of examples. We had a child who was really struggling with their behaviour. We knew their behaviour was trying to communicate something to us, but we just couldn't pinpoint what that was. Partly, we wondered whether we were triggering some of the behaviour. And so we requested the behaviour support service to come in and to give us some advice and to provide a report that would support us in then writing a behaviour support plan or a learning support plan or an IEP as it used to be in the old days. And those reports, sometimes they can take the form of an observation. They might actually be sort of detailed observation with action points. Um, and we would use those to then support us in writing a plan for that child. I think as well, it's about finding out, it's about that professional curiosity. So when you do feel as though you've exhausted all of your avenues as a professional, and sometimes as a parent as well, although parents know their children best, um, but the professional might come in and see something that we don't. I think it's having that objective view from a professional. Um, Sometimes you don't even know who you need to ask. We would invite the behaviour support service in, and they would say, actually, what we're seeing is a child that's really sensory seeking, or trying to gain sensory feedback. So actually, what you need is an OT report. So having a professional in to provide a report then would often prompt us to get other reports. So it's a really, really good way of pulling together lots of people, having another eye on a situation that might not be working very well. The school also might want to find out how a child is responding in school. So, for example, if you've already put into place some provision, the OT might come in just to see how that's working and then provide a report, or they might want to come in and provide you with further advice to pass on to a paediatrician, for example. So I think it's about it's there are lots of different reasons for wanting professional reports. I think one of the best questions I was always asked by the educational psychologist that I worked with was, why do you need this report? What are you hoping to get out of it? And that question used to really stump me for a long time. I always thank her for asking me the question because I knew I'd needed it, but I didn't know why. And actually, it really helped me to clarify why I wanted that report so that she could be really precise in what she then wrote into it. So that was always really helpful. Sometimes schools might want to check their own assessments and their own judgments are accurate or reflective, in which case they might request a cognitive assessment from the elusive cognitive assessment in an EP report. Um, because often school assessments are judgment based and they're not standardized, which we will go into in a bit later on into this webinar. But sometimes there's a discrepancy between schools' judgments and assessments and standardized scores. So it's always really helpful to have those options of those reports because they will help schools to clarify their thinking, clarify their understanding of how a child is presenting. They also might want to request support that's outside of school's remit. So, for example, if I wanted support around, I wanted to request a neurodevelopmental assessment, then obviously I can't do that. I'm just a teacher or a SENCO. So I might request a report from CAMS or SIPS. And yes, we know there are huge waiting lists for these services, sadly. But it's that very specialist knowledge. It's the paediatricians. So those reports are always tend to be more diagnostic focused or focused on things outside of education, but that are supportive. So those are the reasons schools might request reports, not always EHCNAs. But here's the crux of reports for an ECNA. So reports for an ECNA are really important. I think we're probably all here. Many of us probably already know the legal tests for requiring an ECNA, and we also know that it's probably, that it is a low bar within the Children and Families Act. We often, what we all see, and I'm sure lots of you are already seeing this or have seen this, is that local authorities are often turning ECNAs down, and they're often saying that there's a lack of evidence. We do know that's unlawful, but we do know that the more evidence that you have when making the request, the better. that always, and when I talk to clients, I always say it's a really, it kind of seems a little bit the wrong way around, topsy-turvy, because obviously the idea of an educational health and care needs assessment is exactly that, it's an assessment. So the local authority should be requesting the appropriate report.